Panic attack, anxiety attack, are they really that different? What are they? That's what we're going to talk about in today's video. Hi, I'm Dr. Jessica Borshak. I'm a clinical psychologist in California and an expert in acceptance and commitment therapy. And my job on this channel is to help educate you on all the skills and tools you need to go out and live your best life. Let's get started. So when answering this question, I'm going to give you the appropriate clinical definition, and then I'm also going to give you the real world life example and explanation. So when we look at something like panic attacks and anxiety attacks, and we're asking, are these different? Are these the same? What is this? The clinical explanation is there are no such thing as anxiety attacks. That is not in our diagnostic statistical manual. It is simply another term that people use to describe panic attacks. So panic attacks are an intense and sudden surge in fear, discomfort, uncertainty, panic. And it's accompanied by a lot of different sensations, including, shortness of breath, heart racing, fear that you might be dying or going crazy, numbness, tingling, stomach aches, feeling faint or dizzy, feeling like you got an egg stuck in your throat, and a whole lot of other things. I go over it in a different video. That's kind of like the clinical explanation, that it's just panic attacks, and people use the term anxiety attacks as kind of an interchangeable term for panic. But if we're actually looking at how people use these terms, there is a really distinct difference. Panic attacks oftentimes describe the very physical experience of a panic attack, right? The shortness of breath, the heart palpitations, the numbness and tingling, the feeling dizzy and disoriented. That's usually how people use the term panic attacks. But when you're having a panic attack, what often happens is people get stuck in their head. Their mind goes, oh no. God, this can't be happening again. Is something wrong with me? Why can't I take a full breath? What's happening? What's going on? It's this kind of mental panic and rumination that happens. And I think that's really what people mean when they talk about an anxiety attack. It's not necessarily the physical sensations of anxiety that they're describing, but rather this mental fear and rumination, kind of your mind picking on an idea and just chasing it down a rabbit hole until you are overwhelmed, you're scared, you're feeling uncertain of what your next step is. So while it's not an official clinical term, I think it can be really useful for understanding and describing our experience above and beyond just what we're feeling in our body. It also means that we take different strategies to approach anxiety attacks. For panic attacks, we might use different types of exposure, interoceptive exposure, in vivo exposure, and I'll talk about that in a different video of what the treatments of panic attacks and further panic disorder is. But when it comes to anxiety attacks, what we really want to do is help to distinguish between the initial thought that caused the fear and then what we do next. So we can't always stop that initial thought from coming in, that initial worry, but we can, with practice, begin to stop that kind of mental masturbation or, rumination, overwhelm, worry that comes as a result of it. When our mind kind of chases us down that mental rabbit hole, we get lost, we get confused, we feel like we're no longer in control. And we're no longer in the present moment. Our mind's fast forwarded to a future worry or problem. So what we really want to do is do something that brings us back to the moment. You might have a timeout sign or a whoa, whoa, or a picture a stop sign, or, my favorite, some people will just clap and create that really startling sound to jolt them out of the moment. Help them take a breath and ask themselves, okay, what can I control in this moment? What is happening in this moment? What decision do I need to make? What problem can I solve right now? Because oftentimes those future worries, there's not a lot of actionable steps around them. Going over and over and over and overanalyzing and overthinking and overplanning, it doesn't help you solve the problem, and it doesn't help you navigate the fear and anxiety when it actually does show up. So we want to focus on what can I do in this moment to move forward towards the type of life that I want to have. Hopefully this video gives you a jumping off point for understanding anxiety attacks, panic attacks, and where you might begin to understand your experience, notice those patterns, and start to break them. But I have a whole series on panic attacks and anxiety attacks and different skills and strategies and the best treatments. So subscribe and follow along.